In the heart of Rubanda East, where health services were once limited and technology out of reach, a new chapter is unfolding, one that promises to save lives and open digital doors for future generations. At Hamurwa Health Centre IV, a 35 million shillings solar-powered blood refrigerator has been commissioned, an intervention that promises to end years of patient referrals due to lack of emergency blood storage.
Hamurwa Health Centre IV, where we are now, is one of our health center IVs. We have two health center IVs. This is Hamurwa and Muko. And today we are commissioning a solar blood fridge from Bank of Uganda, donated by Bank of Uganda. And this is one of the equipment that we have been lacking at this health facility. We know that blood is an emergency drug. It is needed rarely, but once it is needed, it saves life. And we have been referring mothers from Hamurwa here because our theater is operational. We have been referring mothers to Kabale Regional Referral Hospital for them to receive blood, especially those who bleed too much. And we know that bleeding is one of the leading causes of death among women who are pregnant or who are giving birth. So, because of that, we have been referring those mothers. On average, we have referrals of 15 to 20 mothers per month. And out of those, we find that 5 of them are due to lack of blood at the facility. But now that we have the blood solar fridge, which means that we shall not be affected by interruptions of power. The power here in Rwanda is very unstable, so the power will be stable because it is solar, and therefore we shall always have our blood safe for transfusion, ready for transfusion in case anyone needs that blood.
The donation comes from Bank of Uganda as part of its corporate social responsibility initiative targeting maternal and child health.
Because Bank of Uganda, we are only known by what we do statutory. To a mandate yet, one of which is issuing currency, two monetary policy. When it is economics, we go merenkev. Konkani to shagama ya red to yabantu. Things up with the hand of Bank of Uganda can give people. You must work hard. You must save. You must, financial inclusion is to gamba. Konkani tuyamba chikwizo kashanga abantu baruwire batunture bajya mu bitanda rero katanga kubagamba ngo muyoko mukore mugire sente zo kusavinga omuntu tayine noki namo hokutora kuza kutunga obujanja. When we as a central bank, we care so much about the society where we operate. Very, very important aspect. Before I come in to preach about financial inclusion, let me find a healthy society. Then there I can now start talking about financial inclusion.
kakaba kali kace munonga abantu abisha barabyama hansi na wale bacombe konore bagucabire cikomire konka abamani ga minister na Bank of Uganda batuyamba bakora extension right now ni tekateka ngo abakaza bakwija hano binenda. They are very comfortable and want to thank you so much. Kando mujecho bakaletana n'ibindi bintu mu bintu bibalesire akaba harimo ekitweta CBC machine ekine cyo kugira ngo tukozese kumeshagama y'omuntu urebe umuntu ogeshagama y'ino mubiri nemala ninga nebulabulamo secyecho omubite bimwatuhire complete blood count so mukapeza complete blood count ibaro gitu byamugwandi wasa kupima obwinji bweshagama kumanya ngo umuntu ayine shagama iri kumala ningi ayinete kumala na yetewe shagama mukatweza na scan ubu weni shaganu 2017 tukawa tutine scan hamo na funa one of my staffs na msindika yaza kutraininga yagaruka 2019 unka twashanga twine staff tutine scan minister through your lobbying capacity na Bank of Uganda mukatweza scan 2022 and since then really our patients are getting services.
For Minister Henry Musasizi, the milestone is part of a broader vision to uplift Rubanda through improved healthcare and education.
Health, we cannot financially include everybody, because to talk about financial inclusion, people must be working. In order to work, you must be in good health. Therefore, we strongly advocate for better health services for our people in this place and also in Uganda. The third one is education. We must make sure that our children are able to access quality and affordable education. And to achieve this, we have ensured that all our parishes in this place have got primary schools, and also all our sub-counties at least have one secondary school for USE. And the fourth one is the infrastructure, the road network. At least there must be movement connecting roads from parish to another. There should be movement from one parish to another. So these four, and of course the fifth is the safe water coverage. The safe water coverage is also important for our people. Therefore, these five strong standpoints, what we can call the semantic areas, are the basis under which we have anchored.
From saving lives to shaping futures, just hours later, Musasizi and Bank of Uganda officials were at St. Agatha Girls Secondary School, Kakore, where 10 brand new computers were donated to boost ICT literacy. The equipment comes after a successful fundraiser held in Kampala and a pledge made during an international convention in London.
My pleasure to launch the 10 computers that have been donated by the Bank of Uganda, and I want to thank the Governor of the Central Bank, who is represented by the Bank Secretary, and the team for the support they have given St. Agatha Girls School, Kakore.
We promote education because we believe that you are the future economists. You are the future central bankers. For us, we are just moving and leaving the grounds for you. So I'm happy to hand over the computers that the governor donated to this St. Agatha. I think this was in November, it was in January. Yeah, December, I think. So we're happy to bring the 10 computers that the bank is donating to the school, and we want you to use them and use them for the purpose for which they are given you. At the central bank, all our operations, I can say that at the central bank, all our operations are digital. So we have no choice, even some of us who started studying computer, like she mentioned, at old age, we all have to know how to use the computers because the world is becoming digital. So the central bank is handing over the computers to you. Please go and discover the world. Go and discover the world. Do a lot of research and be sure that you are the next cohort that is going to take us to the next world. You are the next cohort that is going to take us to the moon. So with the ICT, I'm assuring you that you can't go wrong.
You must be consistent in what you are doing. Consistency is part of discipline. Now I'm talking to the teacher. And then focus. And you must have goals. Write about your goals. And you must review your goals and review yourself. You must review progress. So, you young ones, today you are young. You need to ask yourself, where will you be the computers to access information, both offline and online, from digital platforms in the computer, and thereby supplementing the existing book library. We are talking about computers, but how are they important in school? So learners will now be able to use them and access information. Students will get information provided by offline content providers such as cyber school technology solutions, Colby, digital dictionaries, and other related content, as will be accessed by students, and this will improve their academic performance, if not to mention gaining skills as they navigate on the computer. This is very key, Honorable Minister and Madam Susan. Very key, and we thank Bank of Uganda for realizing this. Reducing the computer student ratio. As we speak now, we have a computer student ratio of 1 to 34. And that means that there are girls who end the term without touching a computer. We are saying with this intervention, girls, am I lying? No. Yes. We are saying with this intervention, this will reduce the computer student ratio from 1 to 34 to 1 to 8 upon completion.
From the heartbeat of emergency care to the click of a keyboard, Rubanda is on the move. With strong partnerships and visionary leadership, communities here are beginning to experience development that is not promised but delivered.